What causes scoliosis and can it be prevented?
Scoliosis, I think the first thing that we should say is that scoliosis is not a death sentence to your athletic career. Scoliosis is not a death sentence to you claiming health. Usain Bolt has scoliosis. And there's a lot of other elite athletes, like elite as in the top 0.001% of athletes, that have some degree of scoliosis. The other question you may be asking, because I got ahead of myself, is what is scoliosis? Well, scoliosis is just a curvature of the spine. It can be in any part of the spine, but it tends to be in the lower lumbar or in the mid-back, the thoracic spine. And it's a curve that kind of moves laterally, that takes the straight spine and kind of shifts it to one side. So there's one side that's shifted over, one side that's kind of like a C shape, the other side that's kind of like a cave coming in. There's different degrees of scoliosis. Scoliosis can happen developmentally, but most of the time it happens idiopathically, which means we don't know the cause. We don't really know what brings it on. If it's developmentally, then we start looking at, well, what's the severity of the curve? And people will look at the Cobb angle. And from the Cobb angle, they can decide, well, how much intervention is actually needed for the scoliosis. But oftentimes it's not for function, it's for cosmetic reasons, which I get. Like as a teenager, you don't want to be super shifted over because kids can be mean and you don't want to be ridiculed. So you want to have the surgery to have a fusion, which brings your spine back into a normal alignment. But again, it all depends on how much of a curve that there is. Most curves that we tend to see are more not structurally based in the sense that like the spine grew in that way, but more of a result of function, more as of a result of muscles protecting and guarding. For example, if you have a discomfort on one side of your body and the quadratus lumborum and these other strong muscles that go along the spine, they get the message to protect, and they're protecting down to that one side. They can raise your hip up higher, which then shifts your rib cage over, which then makes it look like there's a scoliosis. And we can get worried that, oh my gosh, my spine's growing in this curve, when the reality is that the muscles are protecting. So if we get rid of the message that's saying protect, well, the spine can go back to its straighter alignment. So that's a crash course on scoliosis. I don't even know if I answered the question. What was the question to begin with?
The question was what causes it and can it be prevented?
Okay. Yeah. So I think we hit on it with those. Can it be prevented? It's hard to say that it can be prevented because we don't really know the cause of it. There might be theories of like prolonged posture. If I sit like this for a prolonged period of times, that my tissues are going to go into that. Again, that's just a theory. I don't know any of the evidence on that, but it's hard to prevent something if we don't really know what's bringing it on. Can we reverse it if it's happening and it's happening as a result of the things that we talked about, like these protective factors and muscle length? Yes. Can it be treated if it's more structural, that the spine is actually growing in that way? Yes. Can it be treated conservatively, meaning without surgery? Potentially. It depends on how much of an angle is happening. If it is a severe angle and it needs to be corrected, then it would be surgical intervention.
Yeah, I think my biggest takeaway from everything you said, yes, the cause, like the causing and the prevention, but also just the reality that you can still be a lifelong athlete with scoliosis. I've had friends tell me like, oh, I have scoliosis, so I can't do this movement. And like, I just want them to know, like, yes, you can, at least in their, because I know for them it's not severe enough where it's like, whatever. I think that they were told like, oh, be careful, be careful, be careful. So it has become more of a fear thing as opposed to like empowered of like, yeah, you have this thing, but like you can still be an athlete, you can still move. Don't be afraid to do these certain movements with your back because of it. So I think my biggest takeaway is like, still be an athlete. You got this.
Yeah. And to high levels, right? Like Usain Bolt, granted he has like a mild scoliosis, but let's remember that he competed in a sport that is all about efficiency. And it's all about getting force to the ground and having vertical force vectors that allow you to then go horizontal in top speed phases. So having a curve automatically makes that harder for you to get these straight line forces to propel yourself. Yeah, he's the fastest man in the world.
Yeah, it's Usain Bolt, for crying out loud.
And he eats chicken nuggies. So we want to get into diet and scoliosis and these things that we've been taught that are preventing us from doing this. Like that would be a long conversation. But anyway, you can have a scoliosis, and depending on and with that, there's even athletes, I don't know the names off the top of my head, but that have a significant scoliosis, like one that's visible to the eye, and they're powerlifting, setting deadlift records, and it doesn't become an advantage by any means by having the scoliosis or having this curve, but it's so cool to see that these people have been able to push through it and say, hey, I have this label of scoliosis, but it's not going to define my performance outcome. I can take care of other factors and still reach incredibly high levels.